students, today we start with the new topic is hepatitis. Definition. Hepatitis is the inflammation of the liver and characterized by the presence of inflammatory cells in the tissue of the organ called as hepatitis. Start with the classification of hepatitis. There are two types of hepatitis, viral hepatitis and a non-viral hepatitis. Viral hepatitis is the most common virus which comes under hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E and newly found that is hepatitis G. And less common viruses are toxic and drug-induced virus hepatitis, alcoholic hepatitis, autoimmune hepatitis, metabolic disorder hepatitis. Now start with the viral hepatitis. That is, what is the source of virus? Hepatitis A was virus sources, feces. Hepatitis B virus is blood derived or blood fluids, and hepatitis B virus, C viruses derived from blood fluid and blood derived, and D same blood derived and blood fluids, and E virus is derived from sources feces. And the route of transmission of hepatitis A is fecal route, and hepatitis B route of transmission is percutaneous or permucosal. Hepatitis C and hepatitis D is the same, percutaneous and permucosal, and hepatitis E is the feco-oral route transmission and a chronic infection. And hepatitis A is not a chronic, it's acute. And hepatitis B, C and a D, these three viruses are the chronic infections, and hepatitis E are the same, it is acute infection, that is no. Now start with the hepatitis A. Hepatitis A virus is usually a benign self-limiting disease and has an incubation period is 15 to 45 days. We already discussed spread, that is a feco-oral route. Now pathogenesis. The immunological basis is suspected, but the evidence is supported is indirect in the form of immunologic markers, but not direct demonstration of to the etiologic agents in the affected hepatocytes. There are two IgG anti-HB hepatitis A virus antibodies or IgG anti-HAV antibodies detected in the serum from the acute illness. Now start with the hepatitis B virus. Hepatitis B virus is caused by HBV infection or HBV virus. The longer incubation period is 30 to 180 days, and in spread we already discussed blood and blood products. And hepatitis B virus is etiological. Hepatitis B virus is a DNA virus and has extensively studied electron microscope study on a serum patients with infected with HBV virus show three forms of viral particles of two sizes, that is small, very small and a large. Small particles are most common and exist in the two forms as 22 mm spheres as tubes 2 nanometer in diameter. And large particles 42 nanometer in diameter are a double-shelled spherical particles called as Dane particles. The genomic structure of HPV is divided in four types. Number one, S gene, we are called as HBsAg. B gene, it is a DNA polymerase. C gene codes for two nucleocapsid proteins, that is HBeAg, and a core protein termed HBcAg. Next is X gene code for HBxAg, which is a small non-particle protein. HBxAg has a role in activation the transcription of both viral and cellular genes. The pathogenesis of hepatitis B virus. The evidence linking immunopathogenic mechanism with the hepatocellular damage is much stronger in HPV infection compared to HIV infection. In support of immune pathogenesis is the demonstration of several immunological markers through serological as well as viral. Now hepatitis C virus. Hepatitis C virus is single-stranded envelope RNA virus which having a diameter of 30 to 60 nanometer, have a genome about 300 amino acids. The genomic organization of SCV shows 5 terminal ends. There is C for capsid region and the envelope regions E1 to E3 in the exons. The viral proteins result in corresponding serological and virological markers for SCV infections comes under number 1 anti-HCV antibodies and HCV RNA antibodies. Anti-HCV antibodies comes under 3 generation of anti-HCV IgG assays. Number 1 first generation antibody against C103 region proteins, second generation antibody C200 and C33C proteins, third generation C22-3 and NS5 region proteins are detected in the anti-HCV antibodies, and HCV RNA infection is so confirmed by HCV RNA employing PCR technique, which can be detected within a few days after exposure to HCV infection. Now, pathogenesis, cell-mediated immune mechanism and production of antivirus cytokines developed by T lymphocytes certainly play a role in hepatocytic injury due to HCV. Hepatitis C virions have not been identified in hepatocytes. HCV infection of lymphoid cells may induce immunologic injury to hepatocytes. Now, hepatitis D virus. Infection with the Delta virus. Hepatitis D virus is also called as hepatitis delta virus in the hepatocyte nuclei of HBsAg positive patient. ये hepatitis B एंटीजन बॉडी के पेशेंट जो होते हैं वो हेपेटाइटिस डी के अंदर पॉजिटिव पाए जाते हैं इन टर्म्स कॉल्ड एज हेपेटाइटिस डी. Hepatitis D virus is a defective virus for which hepatitis B is the helper cells. The hepatitis D develops when there is concomitant hepatitis B infection. Hepatitis D infection and hepatitis B may be simultaneous co-infection, or hepatitis D virus may infect a chronic HBs antigen carrier called as superior infection with co-infection and superior infection. या तो hepatitis D वायरस जो है वो hepatitis B वायरस के साथ आएगा, we call as co-infection. या superior infection में क्या होगा, hepatitis B वायरस की जो एंटीजेंस हैं chronicity लेके hepatitis D वायरस को जनरेट करें, that is called super infection. Co-infection is a acute hepatitis D may range from mild to fulminant hepatitis, but fulminant hepatitis is more likely in such simultaneous delta infection. What happened in the super infection? Super infection incubation period is 30 to 35 days. We call super infection why? Because the chronicity will be present there. The chronic HPV infection get worsened and indicated by appearance of severe and fulminant acute attacks, progression of carrier stage to chronic delta hepatitis, or acceleration towards cirrhosis. Means सुपर इन्फेक्शन जो है वो हेपेटाइटिस बी वायरस की क्रोनिसिटी की वजह से होता है, और उसका टाइम टू ना ट्रीट किया जाए तो इट विल बी कन्वर्टेड इनटू cirrhosis of the liver. Hepatitis B virus is a small single-stranded RNA particle with a diameter of 36 nanometer. It is a double-shelled, and the outer shell consists of HBsAg and the inner shell consists of delta antigen provided by a circular RNA strand. It is highly infectious and can induce hepatitis in any HBsAg positive post HDV. Replication and proliferation takes place within the nuclei of liver cells. Some markers of HDV infection includes HDV identification in the blood and in the liver cell nuclei, hepatitis D antigen detectable in the blood and on fixed liver tissue specimens, anti-HD antibody in acute hepatitis which is initially IgM type and later replaced by IgG type antibodies. Now next is hepatitis E virus. Hepatitis E is an enterically transmitted virus previously labeled as epidemic or enterically transmitted variant of non-A and non-B hepatitis infections. The infection occurs in a young or a middle-aged persons, primarily in India, other Russia, Africa, and Central America. Now, hepatitis E virus is a single-stranded 32 to 34 nanometer ecochatral non-enveloped virus. Serological markers for HIV includes the anti-HIV antibodies and HIV RNA. Now start with the hepatitis. Continue. We cover the viral hepatitis. Now start with the two types of hepatitis divided into acute and a chronic. The acute hepatitis, the acute means the hepatitis less than 6 months we called as acute hepatitis. We generally covered the hepatitis B, C, D and A and E, and the clinical course show identical pathological findings. Now they come under divided into hepatitis 4 categories. Number one, incubation period, pre-isectric phase, isectric phase and a post-isectric phase. Incubation period we already discussed the about less than 6 months. Hepatitis A 15 to 45 days, hepatitis B 30 to 180 days, hepatitis D 30 to 50 days, hepatitis C 20 to 90 days and hepatitis C 15 to 60 days. Pre-isectric phase, isectric phase and post-isectric phase. These phases, three phases are important. Pre-isectric means the person comes under the jaundice. Jaundice में आने से पहले in the phase of jaundice and a post-isectric phase, that is a jaundice के बाद क्या hepatitis में क्या क्या आता है. Pre-isectric phase में क्या होगा, इसमें जो होता है person सिम्टम्स आते हैं nausea, vomiting, fatigue, malaise, this kind of. And isectric phase में क्या होगा, jaundice person को हो चुका है, jaundice disease symptom, constitutive symptoms जो है डिमिनिश हो जाते हैं, यूरिन जो है वो डार्क कलर का होगा और स्टूल जो है वो पेल कलर के होंगे, बिलिरुबिन लेवल एलिवेटेड होगा, इंक्रीज होगा, वेट लॉस होगा, एब्डोमिनल पेन होगा, टेंडरनेस रहेगा, लीवर एनलार्ज रहेगा. पोस्ट ऐसे ही फेज आता है the last phase, that is a recovery lasting phase about 1 to 4 weeks and clinical and biochemical recovery in 2 to 12 weeks. The recovery phase is more prolonged in hepatitis B and hepatitis C virus because they are chronic, and 1 to 2% cases of acute hepatitis may develop severe form of disease and 5 to 10% of cases progress through chronic hepatitis. Grossly देखें तो लीवर जो है वो माइक्रोस्कोपिकली स्लाइटली एनलार्ज्ड होगा, सॉफ्ट होगा, ग्रीनिश फॉर्म में होगा. और माइक्रोस्कोपिकली देखा जाए तो हेपेटोसेलुलर इंजरी होगी, कपर सेल्स एपिप्लेजिया होगा, कोलेस्टेसिस हो सकता है, रीजनरेशन होगा, इन्फ्लामेटरी इन्फिल्ट्रेशंस होगा, मोनोन्यूक्लियर इन्फ्लामेटरी सेल्स प्रेजेंट रहेंगे. नाउ स्टार्ट विद द chronic hepatitis. What is chronic hepatitis? The hepatitis more than 6 months, that is chronic hepatitis. What is happening in the chronic hepatitis? Is a continuing or relapsing hepatic disease for more than 6 months with the symptoms along with a biochemical, serological, histopathological evidence of inflammation and necrosis. दूसरे तौर पे देखें तो इसकी डेफिनेशन होगी, is a continuing relapsing hepatic disease more than 6 months with symptoms called as chronic hepatitis. It is a majority of cases chronic hepatitis are the result of infection of the hepatocytic viruses like hepatitis B, C, D, E and A virus, and non-viral causes like Wilson's disease, alpha-1 antitrypsin deficiency, chronic alcoholism, drug-induced injury and autoimmune diseases. The autoimmune or a liquid hepatitis which is characterized by positive serum autoantibodies, for example anti-nuclear, anti-smooth muscle and anti-mitochondrial, and a positive LE cells, lupus erythematosus cells test will positive but negative for serological virus markers for a viral hepatitis. Now the frequency and severity with which hepatotropic viruses cause chronic hepatitis varies with organism as under. The HCV infection more 40 to 60% to chronicity, and HBV virus causes chronic hepatitis then mostly 90%, and HDV super infection or the HBV viruses and HBCAG will be present there. And HIV and HIV do not produce chronic hepatitis. Hepatitis A, hepatitis E not produce chronicity. Hepatitis B, C and D produce chronicity, and hepatitis C is less common chronic. Hepatitis B is more chronicity, and hepatitis D super infection is chronic. After completion of chronic hepatitis, the grossly features are same: the hepatomegaly, tenderness, and greenish and yellowish discoloration, and microscopically we see that is necrosis, Kupffer cells hyperplasia, and hepatitis C virus show fatty changes, hepatitis B ground glass hepatocytes, HBs antigen in the cytoplasm, and bridging fibrosis will be seen in the liver. Now comes to the clinical picture. General clinical features are fatigue, fever, the pain in abdomen because of the size of increase of liver, and the tenderness of the abdomen, nausea, vomiting, weight loss, jaundice, itching, and most important, sharply pain in the right upper quadrant of the abdomen will be present. Now differential diagnosis. Now diagnostic evaluations. The blood test does LFT, liver function test, and a blood test में हम antibody test भी करवाएंगे, that is IgM for acute infection and IgG for a chronic infection. Now we complete the hepatitis. If you have any query, then ask. Thank you.